Hello, welcome to Baby Child & Co. We are going to talk about a very common phenomenon. We are going to talk about prematurity. Most of you have heard of prematurity because every year there are many babies born premature or preterm. So what is prematurity? It is the birth of a baby before the pregnancy has completed 37 weeks. What are the things that can cause prematurity? Sometimes we don't really know the cause of prematurity. The mother just goes into preterm labor and has a preterm birth. But we know that prematurity is commoner among mothers who did not have good antenatal care. So that means that when you're pregnant, you should attend antenatal the way it should be attended, not just once or twice. And then we also know that prematurity is common among women who have had a preterm birth before. Now, the things we know can cause prematurity include infections. It can be urinary tract infection. It can just be malaria. We know that anemia and other nutritional deficiencies in the pregnant woman can also cause a baby that is premature to be born. We also know that sometimes it's the doctors that intervene and make the baby come out prematurely. Let's say that there are some problems with the placenta or the baby is distressed in the womb, and to save the baby's life, the baby is delivered prematurely. It can also sometimes be because of trauma. The pregnant woman may have fallen or have been involved in a road traffic accident or something and need to have the baby delivered to save the baby. There are other conditions like preeclampsia or severe preeclampsia, that is hypertension that happens when the mother is pregnant. And those ones can also force the doctors to intervene, and then the baby is born prematurely. So we are talking about premature babies because they are very special. They are special because they are so delicate, they are so fragile, they have unique problems that need special care. So what are some of the problems that these premature babies have? The first problem they have is dehydration. Dehydration is the loss of water from their bodies. That is because their skin is immature. So they tend to lose a lot of water through the skin and then they get dehydrated. And dehydration can be a problem because it can affect the other organs of the body. Notably, it can affect the baby's kidneys, which, because the baby is premature, may have issues already. So dehydration can affect the baby's kidneys as well. Another thing that happens because the skin is not so well developed is that they tend to get cold very fast. So they can lose a lot of heat through the skin and through their bodies, and then they get cold very fast. We call that hypothermia. And that makes the babies not thrive. They are not active. They may not be able to fight infections as well as they should. Again, they are prone to infections. These infections can be serious bloodstream infections through their skin, which is not well developed, or through eating contaminated food, or through procedures that may be done for them in hospital, or through handling them when the hygiene is not good. The handler's hygiene is not good. They can get serious infections as well. They can have low blood sugars because when they are so small, so tiny, they don't feed well. And then the liver, which is involved in how much sugar stays in your body, is also not well developed just because they are preterm. So they can have those issues as well. They can have convulsions. They can also have problems with breathing. Actually, breathing problems in preterm babies is one of the commonest problems and the most serious problems that they have. Depending on how preterm they are, the lungs maturity is affected. And so they may have problems with breathing. They may need support with oxygen. Sometimes they may need ventilation and so on and so forth. So it will seem like I'm just giving a lot of bad news, but I'm just saying these things so that you can see that preterm babies have special problems. They are delicate and so they need special care. So now what do we do for these preterm babies? I've said that they have a lot of problems, but there is also so much that we can do for them. The first thing is feeding. So these preterm babies, because they are small, they need to grow. They need to catch up on their weight. And I already said that their sugar stores in their body are not enough. So they tend to go hypoglycemic, which will affect other organs of the body. So feeding is very important. But because they are preterm, their gastrointestinal tract does not move as well as that of term babies. So the feeding must be special. First, breast milk is the preferred food for the preterm babies. The thing about breast milk is that the mother who has delivered prematurely has premature milk, which is suitable for the premature baby. And as the baby grows, the milk also matures. So at every stage in time, the mother's milk is the best for the baby. So we want to give them breast milk or breastfeed as much as possible. But you see, sometimes they are born before they learn how to coordinate their swallowing and breathing at the same time, and the sucking. All those things are affected because they are premature. So sometimes they may not be able to hold the breast and suck. It's too much work for them. It requires too much energy. So what you need to do is to squeeze the milk or express it, and then you feed these premature babies. You can use a cup and spoon to do that. Or sometimes, even if they are able to latch onto the breast and breastfeed, you may need to top up, because they will stop breastfeeding when they are tired, not because they are full. And to make them grow and catch up, you will need to top up the breastfeeds for them as well. So that is feeding. The other thing that you can do for them is hygiene. Wash your hands. Everybody handling the baby should wash their hands. And you see, we all carry things on our skin, in our noses, as we talk, as we sneeze, and so on and so forth. So you should limit the visitors as much as possible to these babies, because they are so very delicate, they are so very fragile. So you shouldn't have a lot of visitors to come, even though you need a lot of help. So you can have a few people helping you take on the house chores and so on, so that you can have time to rest and produce breast milk for your baby. But you should limit the visitors, and you should make sure that your hygiene is good. So skincare for them also. You should clean their skin very gently with mild soap and water. Even cleaning them, there's a way to do that, because like I said, they are very prone to getting cold. So when you are cleaning them, you don't expose the whole body. You expose the top, and then you clean the top. Then you clothe the top, expose the down, and then you clean it. That is what we call top and tail. These babies, their bones are not yet well developed. So the kind of bathing when the baby is turned up and down, they shake the baby and so on. These babies are much too fragile for that. So that should not be done. Molding the head and so on. All those things should not be done when you are cleaning the baby, because they are so fragile. You don't want to break their bones. You don't want to shake their brains. They are so fragile. So gently cleaning of their skin, skincare for them is very important. And then you wrap them well to give them warmth. Warmth will make them grow. Warmth will make the processes that happen in their bodies go on well. When they are too cold, these things are all affected. Another thing that you can do to provide warmth for them, which is very important, is what we call the kangaroo mother care. So kangaroo mother care is simply keeping the baby in front of you in a pouch that you have made from cloth. So you keep the babies there and cover their head with a cap or a blanket, so that they don't lose heat from their heads, and then you carry them in a pouch in front. It makes the baby have skin-to-skin contact with you, the mother. In fact, it's not only the mother that can do kangaroo mother care. Any responsible adult who is clean enough can do it. So fathers can do it, grandmothers can do it as well. But you keep the baby there. You can keep the baby there and breastfeed. You can keep the baby there and lie down and take a rest. The baby is there, is happy, everything is fine. When you do kangaroo mother care, like I said, the baby is in skin-to-skin contact with you. It helps with your bonding with the baby. Sometimes when you have a preterm baby, you are so scared, so bonding is affected. But kangaroo mother care will help the bonding with the baby to get better. And then nice friendly organisms from your skin will move onto the baby's skin, and that prevents bad organisms from coming onto the baby's skin and protects the baby as well. And then your breathing, the baby sort of, because it's feeling your breathing, tends to sort of copy your breathing as well. So it helps with their breathing, because one of the problems that preterm babies have is that they get apnea. They have periods where they sort of stop breathing. You can think about it like they sort of forget to breathe. So kangaroo mother care can also prevent this one. And then because they are in contact with you and there's bonding and so on, it also helps with production of breast milk. I think I didn't mention that they are prone to infection. Or maybe I did. They are prone to infection because their immunity is not yet well developed. And when you breastfeed them, it helps them to avoid infection, because breast milk is not only food. It is food, and it is the baby's first vaccine as well. So when you breastfeed them, it helps to protect them from infection. The preterm babies as well, they are at risk of jaundice. Jaundice, we have done a video on. It is yellow discoloration of the skin and the eyes of the baby, the white of the eyes of the baby. So they are at risk of jaundice as well. What can help you to make the jaundice better or even prevent it is early breastfeeding. It can help that, because when they pass their stools, the yellow color that causes the jaundice, some of it comes out in the stools or the toilet or the poo of the baby. And then, of course, as soon as you notice the jaundice, you should prompt the healthcare workers so that it can be treated, because like we have said before, jaundice can cause disability and jaundice can cause death in the babies as well. So, I hope I have talked to you about premature babies. I have said that they have a lot of problems, but it is not all gloomy. Like I've said, these are things that you can do that are simple. It costs nothing to do kangaroo mother care. It costs nothing to breastfeed your baby. And these babies as well will need follow-up for some time, because as they grow, we want to see, are they attaining the milestones? We know that by the time they are 2 years old, they should catch up with the growth. As if they were 10 babies, they should catch up. So we'll follow them. Are they thriving? Are they growing well? Are they gaining weight? And when they are supposed to sit, have they sat down? So when you are discharged from hospital after having a preterm birth, that should not end your contact with the doctors or the healthcare providers. The other thing is you should make sure that you follow through with the immunizations. Preterm babies should have immunizations just like the term babies should have, because these things tend to protect them from illnesses and diseases as well. We've already talked about nutrition. You do exclusive breastfeeding, top up, and then you can follow on later with complementary feeding. So if you have other questions about premature babies or preterm births, please leave them in the comment section. We'll be happy to attend to them. We ask that you please subscribe to this channel, because we talk about all the things that you need to know to keep your babies healthy. If there are topics that you want us to talk about, you can leave them in the comment section, and then we will do a video on those ones for you, because we are interested in you keeping your babies healthy. When they are healthy, the whole family is happy, and we are happy as well. You should visit our blog. It's called babychildandco.com. When you go there, there are so many things you can do. Read an article, you can join the parenting club, you can join our community forum as well. We'll be happy to have you. Thank you. Bye.